Good afternoon, everyone, and happy Civic Health Month. We are just getting ready to begin today's community conversation, and we're just going to give it another moment or two to see if anybody else is trying to connect, and then we'll get started. So thanks for joining us today, and we'll get underway in just a moment or so. Oh, Alberto's here.
Alberto, what a pleasant surprise.
Hi, how are you?
Hi, Alberto.
Good.
Nice to see you.
Nice to see you too.
You're going to get to see your own face in today's presentation, Alberto.
Oh, okay.
In our lovely video that we made with voting and
Oh,
social work.
all right.
Thanks for being here.
Oh, you're welcome. Excited.
We'll be getting started in just another moment or so, everyone. We're just waiting to see if anybody is trying to connect still. So we'll give it another minute or so, and then we'll get started. We just had a few people join. You want to come up, buddy? Come here. Looks like the dog is watching the webinar with us today. Okay, why don't we get started? Happy Civic Health Month, and welcome to today's webinar, Civic Engagement as a Social Work Intervention, where macro meets micro. And I'm very excited to be here with some presenters from the organization Vot-ER, who will be leading us in discussion today. And we're going to learn all kinds of interesting stuff about how civic health can improve, civic engagement can help improve health outcomes, and how you all can go about helping your clients make sure that they are registered to vote. Before we begin, I do just want to remind you all that this webinar is being recorded for future use. So please try to remain on mute. And if you do unmute to ask a question, please just remember to be appropriate in your comments as we are recording. We will hold Q&A until the end, but feel free to put questions in the chat as they come to you. And if something does seem to be worth addressing in the immediate, we'll interrupt the presenters so they can address your question. So with that, I'm very happy to turn things over to Chelsea and Madison. Chelsea?
Yes, thank you so much, Jeff. I'm going to go ahead and share my screen. Can you give me a thumbs up if you're seeing that, Jeff and Alberto? Perfect, great. Awesome, y'all. Thank you so much for joining us today for this webinar. We are so grateful to the New Jersey chapter of the NASW for hosting us today and for making space to discuss the importance of civic engagement as a social work intervention. Before we dive into the material for today, I think that me and my colleagues should introduce ourselves so you have a little bit of an idea of who is talking to you and presenting this information. So I'll turn it over to Madison to introduce yourself first.
Hi everyone, I'm Madison. I use she, her pronouns. I am an MSW student at Boston University and an intern here at Vot-ER. I'm really excited to be presenting with Chelsea today. So thank you, Jeff, for having us.
Thank you so much, Madison and Jeff. And like Jeff mentioned, my name is Chelsea Wright-Hoagland. I use she and they pronouns interchangeably, and I'm a social worker with both a BSW and an MSW. I grew up in the Appalachian Mountains of Western North Carolina, where I've lived my whole life and where I got my social work education from Western Carolina University. And growing up in Appalachia, I was raised by a single mom who was very poor, and it didn't take very long for me to realize that pretty much everybody in my community was basically just as poor as we were. And it was in social work school that I started to realize that when issues are experienced across entire communities and groups of people, that we can't just tackle those issues on an individual level. We have to tackle them on that community level, on that social level. So for the last 10 years, my career has been in macro social work, specifically in community organizing. where I've been really dedicated to restructuring political systems by using evidence-based healing practices that we use in social work in order to facilitate deep democracy, transformative relationships founded in mutual aid and community autonomy and self-determination. And while my career has largely been focused in macro work, I have many colleagues and friends who are brilliant social workers in clinical and other micro settings. And I also realized that social workers in all of these settings are in a unique position to bridge the gap between the macro and the micro aspects of our field. And I want to help make that possible, which brings me to our presentation today. So just so we all know what's going to happen today, our intention for our time together over the next 45 minutes or so is to examine the connections between civic engagement and health outcomes and social work, along with the research that supports those connections. And then we'll talk about some of the clinical tools and resources that are available to you for integrating civic engagement into your own practice settings. And then finally, we'll talk about some institutional partnership opportunities for those of you who work in teams that are based out of institutions. And then, of course, we'll make space for questions at the end, like Jeff mentioned. So please drop those in the chat as they come up for you. Don't hold back. So for those of you who might not have heard of Vot-ER before, we are a national nonprofit that connects healthcare institutions and human services providers with nonpartisan resources and training to be able to implement civic engagement as an intervention and prevention tool among the services that they provide. And just to give a little bit of background context, Vot-ER was started in 2019 by an ER doctor named Alistair Martin, who was working at Mass General Hospital at the time. And one night he had a woman come into his ER with her 2 children. And she explained to Dr. Martin that she had just recently been brought into Massachusetts by a partner who she was now attempting to get away from due to intimate partner violence. She had been sleeping with her 2 children in her car because she wasn't sure where else to go and what her options were. And she told Dr. Martin that on this particular night, she had looked into the back seat and saw her youngest child shivering. And she knew that she wouldn't be able to keep them in the car again that night. So she came to the hospital instead, the only place that she knew would be open. She asked Dr. Martin if he would be able to help her. And he said, of course, even though inside his head, he had no idea how he was about to help this woman. So who did Dr. Martin call in such a predicament? The social worker on duty, of course, the hero. And in Massachusetts, the social worker explained that they could, in fact, get this woman and her children into a shelter, but that she would need proof of residency. Well, of course, she wouldn't have proof of residency since she had just recently been brought over state lines. And when Dr. Martin explained the situation, the social worker's response was, no problem. Here in Massachusetts, we can register her to vote in order to establish residency if that is something that she's open to. So Dr. Martin went back to the woman and said, I know this might be a little bit weird, but would you be interested in registering to vote? And the woman actually started tearing up. And her response was, no one's ever asked me that before. I didn't know that was something that I could do. And that is when Dr. Martin's life changed forever and he gave birth to Vot-ER. And since that moment, we have built partnerships with a collection of hundreds of phenomenal partners like Get Waiver's Opioid Recovery Team, the National Association of Community Health Centers, and multiple state chapters of the NASW, like New Jersey, who have collectively prepared more than 47,000 voters for civic engagement since 2019 when we launched by using our tools at Vot-ER. So now that you know a little bit about who we are, let's talk about the actual concepts of civic health and voting as recovery that kind of took off from this moment that Dr. Martin experienced. Now, to start with, there are a ton of tools that can be used to support prevention and recovery. And voting is just one of those tools. It's just one, but it is a powerful one. And we're going to dig into the research that shows that our communities are healthier when voters have access to the self-determination, the autonomy, and the connectedness that come from participating in the democratic process. But why voter registration in social work and substance use and mental health treatment? Well, when we look at the group of voters that are eligible to vote, but are unregistered or unlikely to participate in the democratic process, which, by the way, includes more than 51 million people in the United States of America, the equivalent of the entire population of Spain, just for reference, is eligible voters that are either unregistered or unlikely to participate. And when we look at that group of people, we see that that group of voters shares a stark overlap with the historically marginalized groups of patients that are also likely to experience mental health struggles and challenges related to substance use and inequitable and inadequate care, unaffordable care. Folks that are young, low income, people of color, LGBTQ+, rural communities like the one I live in. And we know that in your treatment spaces and interactions with your clients as social workers in particular, you are developing a unique therapeutic relationship that allows you to serve as trusted messengers in regards to providing accurate information about civic engagement. And with that comes a great opportunity for bringing these potential voters into the electorate who otherwise would be excluded. And I just want to talk a little bit about what happens when folks are excluded from the democratic process, because when they are excluded, not only are their voices not being heard by the elected officials who ultimately make the decisions that impact their lives, but they're also being thrusted into this harmful feedback loop that undermines their self-determination and autonomy in the civic process. I've done a lot of work in my career on political campaigns, even for candidate campaigns, and political campaigns, like a lot of the services that we provide as social workers, operate on limited resources and limited funding. That's why we're always getting so many fundraising calls and texts from these campaigns, right? And what that means is that they have to intentionally decide how to use those resources and that money in a way that maximizes the outcome towards their goals. And their goal is to get voters to vote for their candidate, right? And so that means that they are going to use their resources on voters that are already pretty likely to go to the polls, rather than voters that are going to take more effort and more resources to turn out, so they can save their campaigns money and time. And so what they do is they talk to high likelihood voters, and then all of the voters that haven't participated in the past before don't get contacted by those political campaigns, and then they end up feeling ignored, unheard, apathetic, cynical about the political process, and they end up sitting out the election again. And as a result, they reinforce the political campaign's exclusionary practices. They basically affirm, right? It was a good decision not to talk to us because we didn't go to the polls. And then the politicians end up serving as elected officials that don't shape policies that reflect the needs of those excluded voters because they didn't hear from them in the first place. So this loop just continues and spirals. And a good way of imagining how elections, which result in underrepresentation of these marginalized voices, can also lead to negative health outcomes for those same disenfranchised communities, is by looking at a stream of water. So at the very tippy top of the mountain, we've got the upstream structural determinants, and these are the policies that our elected leaders put into place. These often can lead to the health inequities that we refer to as the root causes of a lot of health issues. So for example, when we think about the opioid crisis, the overdose crisis, and the settlement funding that's going to be coming down from the cases against the largest opioid distributors, elected officials are going to be ultimately the ones who decide how to spend that money. So they will determine the structural implications of that funding. They could spend it on police forces, they could spend it on Narcan distribution or other harm reduction efforts, they could spend it on substance use education and prevention efforts, they could spend it on trauma recovery, and on and on. And then we get to where we see our homes and our trees and our factories about midway downstream. And these are our social determinants, which are essentially the results or downstream effects of those structural and political determinants. These are the conditions and the environments that people live in, that they grow up in, that they're exposed to. So once an elected official decides how to spend that settlement funding, the social determinants might look like more or less available recovery and treatment options for them to seek out in their community. stronger police presence and more aggression towards substance users, the availability of harm reduction materials and or safe consumption sites or medicine-assisted treatment. And then ultimately downstream, all the way down here at the lake where all of this water is pulling up, the downstream effect of the structural determinants are the health outcomes of our clients. Some effects at this level can include higher or lower rates of overdose, higher or lower rates of incarceration, more trauma symptoms, health complications due to unsafe substance use, infections, more ER visits, and on and on and on. And so in order to prevent negative downstream health outcomes, we have to make sure that the voices of the communities that we serve are being heard in the democratic process, all the way at the top of the stream. And when we address that feedback loop that I showed you, by engaging our clients about voter registration and participating in the civic process, the positive impact of our intervention can be observed and studied on multiple levels. On the micro individual level, we see that civically engaged individuals experience improved mood, self-efficacy, self-determination, dignity, empowerment, social connections, and health outcomes in general. In communities of folks that are in active substance use or mental health crisis, these aspects can be especially supportive for the healing and recovery process. One international study of 44 countries saw that civically engaged patients were associated with better self-reported health, regardless of their cultural differences. Other studies have found that individuals that do not stay civically engaged report poorer health in the preceding years. And then finally, in an analysis of data collected from almost 300,000 survey respondents, that analysis found that voting is consistently positively associated with higher self-rated health scores, independent of income inequality. On the mezzo level, on the social level, when Vot-ER surveyed our providers and medical students who got involved with our work, we found that an overwhelming number of providers got involved because they cared deeply about addressing these social inequities. And healthcare providers and social workers, I don't even have to tell y'all this, we often struggle working within a system that doesn't help the most vulnerable and doesn't address the most marginalized communities. And so engaging with patients around civic participation has served as an outlet for providers to make a positive impact for those patients. When we surveyed our providers at Vot-ER, half of our survey respondents said that they used their Vot-ER tools to improve social determinants of health, and 93% said that their efforts represented a positive, immediate impact that they can have on their community and their community's health. 79% said that Vot-ER increased their sense of connection to other healthcare providers. 51% said that Vot-ER helped to prevent workplace burnout, which is a huge one for social workers. And 81% said that doing this work made them feel more hopeful in their own work. And then on that macro level, when we zoom out to as much as we can, we see that policies that more effectively solve public health problems are more likely to be implemented when vulnerable populations participate in civic engagement and when voters turn out in larger numbers that are more accurately representative of the broader electorate. When we include the voices of the most marginalized populations in the democratic process, the results are policies that effectively meet the needs of those populations and are less likely to cause harm or contribute to their marginalization. And not only are the effects of voter turnout beneficial, but they are substantial. Research shows that expanded turnout that includes marginalized populations could increase the amount of money going into public support programs by up to 1/3. So imagine if the agencies that you work at had an additional 1/3 of the funding that you currently operate on. And then imagine if every agency that existed were able to expand their resources in that same way. And perhaps most importantly, what we are seeing in this graph is that voters who are touched by a nonprofit, and by touched, I mean like engaged around the democratic process, invited to participate in voter registration, when they are engaged by a nonprofit where they already receive services, they have the largest turnout advantage when compared to voters in the general electorate who are being approached by political campaigns and strangers on the streets. And when nonprofits reached out to their communities that they serve of color, they had dramatic improvements of voter turnout and the largest turnout advantage. And we confirmed this at Vot-ER in our own work. We've learned since we got started in 2019 that healthcare-based voter access works, and it results in higher turnout by almost 20% as compared to traditional get out the vote organizations. And not only is this intervention effective, it is expected of social workers. And I think it's easy to forget how deeply integrated the macro lens and approach to social problems is in our field. But I wanted to pull out some of the key statements from our professional code of ethics to illustrate how doing this work and integrating civic engagement into our practice is quite literally our job, no matter what setting we work in, whether it's clinical, bureaucratic, something else entirely. The first ethical principle is the principle of social workers' primary goal is to help people in need and to address social problems. It doesn't end at helping people in need, right? It's our primary goal is helping people in need and addressing social problems. And addressing social problems requires us to invite our clients to participate in the democratic process as the ones who are directly impacted and are most oppressed by those social problems. Ignoring the role of the civic process in catalyzing and maintaining those social problems denies an entire scope of evidence-based intervention opportunity that we social workers absolutely need to be looking at. The second ethical principle is the one that's related to the value of social justice, of course, which describes social workers as being upheld to challenge social injustice. And the NASW reminds us that in order to challenge social injustice, we must lift up the voices and the power of those who are suffering at the hands of injustice. Our code of ethics specifically calls on social workers to ensure access to meaningful participation in decision-making for all people. And the democratic process is a huge area for meaningful participation in decision-making. The third ethical principle that I wanted to lift up was the one that's tied to the value of the importance of human relationships. Social workers recognize the central importance of human relationships. Human relationships are the fabric of the shared communal power that is necessary to address social problems from a grassroots level. And civic engagement offers human connection in a powerful, solution-oriented way. Civic engagement isn't just about an individual's relationship to the systems that impact them. It's also about their sense of relationship to their community and the shared impacts and experiences and their ability to create shared change for one another when they speak their truth to power within the systems. And then the last ethical principle that I wanted to lift up is tied to our value of the dignity and worth of the person, where we respect the inherent dignity and worth of every person. We as social workers promote clients' socially responsible self-determination. And one of the easiest and most crucial ways for social workers to promote this with their clients is by inviting them to participate in the democratic process through civic engagement. Social workers seek to enhance our clients' capacity and opportunity to change and address their own needs. If social workers don't include civic engagement as one of the capacities that we seek to enhance, then we're missing a massive opportunity for our clients to engage in change and addressing their own needs along with the needs of their community. But don't just take our word for it. I'm going to share a quick little video so that you can hear straight from the social workers who have been doing this work on the ground already. And I just want to make sure I've got my sound settings perfect. All right.
Vot-ER was inspired by an experience that I had with a social work colleague taking care of a patient right here in this emergency department. And social work really is at the core of what makes Vot-ER so special.
Voting is social work. Integrates voter registration and civic participation into social work, education, and practice nationwide. We work with schools, professional organizations, and agencies around the country
Social workers have always understood the importance of voting to political action, community power, and social change. Since its founding in 1955, the National Association of Social Workers has promoted open access to the ballot box.
The Healthy Democracy Toolkit is an important additional clinical tool that I use that both helps me build on the legacy of voting rights in the social work profession, but also helps my clients have a say in the policies that affect their day-to-day lives.
After every biopsychosocial assessment, I like to ask my client if they've registered to vote and then assess different barriers that maybe my client has experienced either in the past or currently in terms of registering to vote or getting out to vote in a safe and healthy manner.
Empowering clients to vote by integrating voter registration into my clinical practice has been transformational. Registering our clients to vote and explaining the way their vote matters, especially in local elections, is a way we can empower our clients to be heard.
Voting is good for you and for our society. People who vote report more employment, better health and mental health, stronger social connections, and most important, a greater say in the decisions that affect their lives. Without the vote, there can be no social justice and no democracy.
Elections happen every year. Voter engagement and education is part of our social work code of ethics. But where do we begin? You can start by helping your clients get ready to vote.
Vot-ER was inspired by an experience that I had.
There we go. All right. I also wanted to share one example of a social worker that I'm currently working with, actually, who's based out of North Dakota, where voter registration is not something that they do. Everyone's automatically registered to vote, which, wow, isn't that actually phenomenal? But at their institution, given the situation, every new client already receives a full social determinants of health assessment that then allows them to be assigned to a follow-up as needed. And so what this social worker has done is incorporated into that social determinants questionnaire a question that's phrased as, how prepared do you feel to participate in the upcoming election? Kind of on like a Richter scale. And that has allowed them to open up a dialogue about the barriers to voting that their clients are experiencing, and whether those barriers are logistical, emotional, informational, cognitive, or something else entirely. And then the other thing that I wanted to share as an example is actually from my own personal work prior to Vot-ER, when I was doing work for a local grassroots community org here in Western North Carolina. And we started our work by doing a community listening survey in order to assess what actual issues folks wanted us to address in the organization that I was working with. And while we were conducting this survey, we happened to come across one individual who was sleeping on their friend's couch the night before, but otherwise was totally unsheltered. And the reason was they were in active substance use, and their experience in substance use had caused them to lose custody of their child. They had lost their housing, they had lost their employment, and they had lost a good number of the people that they considered close friends to overdose or other death via substance use. And so as I was talking to this person, their exact words to me were, I intend to use till I die. They did not see an alternative path for them because they had seen so many other people in their community succumb to the same fate, and because they had had so much of their sense of self-worth and dignity eroded by the community around them, who had stigmatized them for their substance use and painted them as an addict, right? Rather than a human being who was probably extremely traumatized and had been struggling. And through the course of our relationship, our working relationship in this organization that I was with, this person, I began to have the opportunity to ask this person what would make a difference in their community, specifically in the community of folks who are being lost to substance use. And they wanted to prevent overdoses more than anything else. And so we talked about how there is actually evidence-based practices in place for preventing overdose and how there are organizations that do harm reduction work and distribute Narcan and those types of materials. And through talking to this person and even asking them what they would like to see change in their community and reminding them that they actually do have an opinion on that, that is valid and important, they then began advocating for the implementation of Narcan distribution and harm reduction efforts and won a local harm reduction program from our local health department, and then went on to restore their employment, restore part-time custody of their child, and secure stable housing. All of that made possible through this restoration of their sense of dignity and self-worth, and the idea that they were actually more than just a substance user. They were a part of a community who deserved as much of a say in the decisions that were impacting their lives and ultimately killing them just as much as anyone else. And we're coming to you with this webinar at this particular time, not because August 2nd just was an arbitrary date that felt like a good time to point at the calendar and host a webinar, but actually because this is the perfect time for social workers in our institutions to be implementing this intervention into our services if we aren't already doing that. This month, like Jeff mentioned, August, is known as Civic Health Month. This is an entire month that is dedicated to intentional civic engagement in healthcare and human services spaces. There are different types of providers that are using our tools and starting conversations about the democratic process in honor of this month, along with all kinds of special events that will be taking place, like Vot-ER's Civic Health Conference on the 12th and 13th, which is virtual and free to attend, by the way, if you want to hop in there. And also like International Overdose Awareness Day, which just so happens to fall on the last day of Civic Health Month. Also next month, as many of you probably already know, if you work in recovery or substance use, it's Recovery Month in September, which is a period of time that is dedicated to uplifting the recovery community and supporting the evidence-based treatment and recovery practices that the community can benefit from. And Recovery Month is the perfect opportunity to incorporate voter registration tools into recovery events, community recovery fairs, and whatever else organizations and agencies might already have going on in honor of that month. And it's incredibly convenient, almost serendipitous, if you will, that National Voter Registration Day happens to fall right in the middle of Recovery Month on September 20th. It's almost as if we were meant to make the connections between all of these systems that overlap and impact the behavior, well-being, and health of our clients. And so with all of that said, I will pass it over to Madison now to tell us more about the clinical tools and resources that are available for you to use in your own practice settings between now and the election and well into the future.
All right, thank you, Chelsea. So Vot-ER is making it super easy for recovery professionals and professionals at all levels of the healthcare system to incorporate civic engagement into their practice by providing compliant, safe, and nonpartisan tools like badge backers, posters and patient handouts, and conversation starters to support professionals with the process of inviting their clients and community members to check their voter registration or vote by mail without intervening in the flow of services. Patients are able to scan a QR code, text a special number, or visit a link in order to be directed to a user-friendly portal that walks them through the voter registration process, saving the service providers time and energy while still allowing them to encourage voter engagement with their patients. Thank you. I know we're always looking for ways to show our commitment to voting rights and health equity, and registering our patients with Vot-ER's help is easy, nonpartisan, and a perfect way to do that. Vot-ER is completely optional and won't interrupt our providers as they care for patients, and is politically neutral. Both the badges and the posters feature a QR code, a short text code, and a web URL that are unique to the providers at your institution. So for those who are unfamiliar, this is what a QR code looks like. The short text code is referring to the option described as text Vot-NJ to 34444. And the web URL is referring to the option described as visit Vot.Health/NJ. So clients can engage with these tools in one of three ways. They can use the camera on their smartphone to scan the QR code from either the badge or the poster. They can use any cell phone, even an old school Motorola, to text the short code to 34444. Or they can use any device, phone, tablet, computer, etc., to visit the web URL. And then they can click on the appropriate option related to voter registration or voting by mail. And next, they will arrive at one of these two forms. The form on their left is for voter registration. They are prompted to enter their name and zip code, and from there, they will be redirected to the New Jersey DMV to go through the process of online voter registration. We do not collect any of their contact information or medical information. And since we are a national organization and there are patients from all 50 states that are using this platform, we use the zip code to filter them to the correct state's Board of Elections.
And just to add to this, because we didn't put this in our speaker notes, sorry, Madison, the form in the center is for requesting an absentee ballot. And so if someone is interested in filling out a ballot and turning it in from afar, they're either traveling, sick, they don't need an excuse, they can fill out this form. And the cool thing about the form on our website is that we have prepaid for the postage if they fill out this form with Vot-ER. If they go directly to their bureaucratic institution and fill out the absentee ballot request form, they will receive an absentee ballot in the mail, but they will have to figure out how to return it on their own. If they fill out our form, they'll receive their absentee ballot in the mail along with a prepaid postage return envelope.
Yes, thank you so much, Chelsea. Don't want to forget that part. So one of the questions that we're frequently asked by providers is, what if patients have questions about voter registration that I cannot answer? The good news is that your interaction with the patient should only involve you inviting them to engage with the tools. Our goal is to incorporate civic engagement into your clinic while maintaining respect for your priorities as service providers and the job you signed up for, which means that we don't expect you to walk them through the process of registering to vote or to answer any questions. This is because we have a partnership with a nonpartisan organization called Vot-Writers, whose mission is to be able to answer questions from voters and provide them with accurate, up-to-date information related to voter registration, election laws, and voting requirements. So on the portal at the bottom of the page, there's this button that says text us. You can let your patients know that if they have any questions related to the registration process, they can direct chat when they can answer their questions quickly and easily using that button. And also at the top of that page, there's a similar button that will convert the tools to Spanish for patients for whom that is their primary or preferred language. Okay, so what is a service provider's role in all of this? To simply invite the patients to engage with the tools, show them how to pull up the landing page, and let them take it from there. A 20-second task of asking them if they are registered to vote or pointing them in the direction of the tools. What does this look like to invite your patients to engage with the tools? Well, the answer is it can look like whatever works best for you and fits in the structure of your services or visit. That said, we have collaborated with voting experts and healthcare professionals to provide scripts that are nonpartisan, research-backed, and appropriate for most clinical settings. The scripts are available on our website, but I'll give you a quick rundown. One way to introduce these tools to patients is during the social history portion of their visit. When asking other questions, such as, do you smoke, do you drink, are you safe at home? You can add, are you registered to vote? Or at the end of social history, such as, we're all done with this part of your history. I now want to transition to something else that's really important to your health and well-being, and that's voting. Are you registered to vote? Another way to introduce these tools to patients is at the end of a patient's visit. This might sound like, before I leave, I'd like to check if you are eligible to vote and registered to vote at your current address. Your vote is a powerful tool to address and improve issues that you care about, like your health. And there are a couple other examples on the website too. So part of building rapport as social workers is knowing how to talk about challenging topics or uncomfortable topics, which elections can often be. The key here is to focus on the power that our vote has when it comes to bringing resources into our communities, like the resources that we offer as social workers. Remind your clients and colleagues that even if they just pick one race to vote in, they can help shape what resources our community has access to. Regardless of what type of setting you work in, recovery, intimate partner violence, mental health treatment, foster care, etc., you can still use our scripts and talk to anyone about the power of their vote. A quick 1, 2, 3 formula is emphasized by the bold statements on the slide. Number 1, introduce the concept of voting as a powerful tool. Number 2, bridge with relevant dialogue about how a small number of voters can make a big difference in our local community elections and resources. And 3, invite them to take action by scanning the QR code or engaging with the materials in another way. Social workers are also particularly prepared for dealing with skepticism and cynicism that surrounds the democratic process today. We have the tools to validate and affirm the sense of hopelessness and powerfulness that a lot of folks are feeling, while also walking them through the cognitive dissonance and overcoming the barriers they experience around participating in elections. And we get asked, is it legal? Yep. The National Voting Rights Act of 1993 actually encourages this type of nonpartisan voter registration in health centers. So, where do you access your tools? Number 1, you can order a free Vot-ER badge for yourself to use with your clients and community members. Number 2, while you wait for your badge to arrive in the mail, download a virtual badge and phone background from the New Jersey NASW website. And you can order posters and handouts to put up at your agency or to hand out at recovery events or other community activities. And with that, I'm going to pass it back to Chelsea to talk about institutional partnerships.
Thanks, Madison. And I dropped the links for folks to the 3 things on this slide in the chat. So the first link is to get your own badge, which will probably take about 30 days to arrive in the mail just because of shipping and design and printing. So while you wait, the second link is the one to get the virtual badge from the New Jersey NASW website. Thank you, Jeff, so much for setting that up in advance. And then the third link is to order posters and handouts, which will have about a 30-day time frame as well for arrival in the mail because we will print them and ship them to you. But you can also order digital materials that can be arrived in your inbox within a week or so. So let's talk about institutional partnerships. The last thing that we wanted to touch on is that you don't need to do this by yourself. We would love for your institution to be a part of this collective work to improve the culture of health by improving access to the democratic process. Like I mentioned at the beginning of this presentation, Vot-ER has built partnerships with hundreds of phenomenal partners, including tons of state chapters of the NASW and individual institutions and community health centers and Get Waivered and so on and so on. And so your agency or organization, no matter how large or how small, can be recognized alongside of these esteemed members of the Civic Health Month network by signing up to become a Civic Health Month partner or champion. And we're going to drop the link for you to check out the sign up form for that in the chat. Alternatively, if you work at or know of a recovery-oriented agency that is already doing this work or should be doing this work, they can also be recognized for their integration of civic engagement tools into their recovery and overdose prevention efforts by signing up as a partner for Voting is Recovery. And I'll share the link for that in the chat as well. And perhaps what I feel is the most important is that we want the upcoming generation of social workers to be integrating the micro, meso, and macro aspects of our work from the very beginning of their career, regardless of which direction they decide to take their work in. So there's a few opportunities that you can support students in meeting their learning objectives, educational competencies, and living up to their ethical principles related to social justice, advocacy, and civic engagement. If you work with students or in an academic setting, whether you are a supervisor of an intern in your agency or whether you actually work in a school. If you're a professor, you can use Civic Health Month and Recovery Month as a great excuse to teach about civic engagement and social work explicitly, especially in courses like Intro to Social Work, Policy, Advocacy. Field seminar courses are a great one, and any courses related to recovery explicitly. We are happy to provide guest presenters with a social work background from Vot-ER if that's helpful. I personally love working with students and would be happy to talk to your classes. If I wasn't in community organizing, I would probably be in social work education. And so I'll drop my contact information so that you can reach out to me if that's something that you would like to learn more about. And if you're a field director, or if you work closely with a field director, you can integrate, or if you supervise an intern, you can integrate voter registration into learning contracts for field placements in the fall. You can also sign up to participate in our 2023 March Healthy Democracy campaign as part of Social Work Month. This is an event where social work programs from across the country and the students in those programs compete to register the most voters from their field placements, their campus communities, and more. And then, of course, you can always order and distribute badges to your students and train them on how to use them, offer extra credit, if you will, whatever floats your boat. But just to recap, regardless of the setting that we work in, social workers are different from every other profession. And what makes us different is our professional code of ethics. Our professional code of ethics doesn't just encourage us to do this work, it requires us to do this work. We are in a unique position to understand how all of these systems are interconnected and are impacting the clients that we serve on a daily basis. And in case some of you haven't heard the babies in the river analogy, I actually heard this analogy for the first time when I was in undergraduate school pursuing my social work degree. And the analogy compares our society to a river. And all of our clients are babies that are floating down a river. Every client that is struggling with housing, with poverty, with substance use, with unhealed trauma, in this analogy, they're all babies floating down this river. And as helpers, professional helpers, we can only pull so many babies out of the river on our own. We only have 2 hands per social worker, right? And we're eventually going to get tired and we need to take a break. Eventually, we're going to have to go upstream and stop the babies from ending up in the river to start with. And the best way to do that is to open the door for self-determination so that those babies, our clients, have access to the resources that they need to make the best informed decisions for their lives and be able to thrive. So that wraps up everything that we came to share with you today, right about on time. Pretty proud of ourselves. And we would love to stick around for the next 10, 12 minutes or so and take any questions that you all might be holding.
Chelsea and Madison, thank you so much for that fantastic presentation. Really, really appreciated it. Really interesting. And I just want to reiterate again, you can find the New Jersey coded digital Vot-ER badges right on the NASW New Jersey website. Just go to NASW-NJ.org and it's the main message on our head site. You'll see when you go to our webpage, you'll see a big banner for Civic Health Month. And when you click the Learn More button, it will take you right to the Civic Health Month webpage. So it's really easy to find. And then you can download the New Jersey coded digital badges and start using them immediately. Do we have questions for Chelsea or Madison? Feel free to put them in the chat, or if you'd like to raise your Zoom hand and come online, we can ask you to unmute and you can ask your question directly. Audra?
Thank you so much. This is great material. I completely feel enlivened as someone who's been in micro for a really long time and is now looking, to intertwine this with work and cross over into macro. The question that I have is, what's come up for me is when I talk about this issue of voting and how important it is, some people have started countering with, but I'm already voting for the people that are, I don't know how to say this, allocating the resources, but, I think there's just this feeling of stuckness going on. And so I've tried to talk about, compromise. So climate change is one, I live on the East Coast in New Jersey, this keeps coming up over and over. And so I'm not exactly entirely sure if my question makes any sense, but it's just breaking through that. Yes, but I've done this. Yes, but I've done this. And that hopelessness and that helplessness that's out there. I'm just wondering if anyone has any tips or strategies for that. And thank you again.
Such a good question. Thank you for bringing that up. I think it is, the times that we live in are very disheartening and can make folks feel like they are very powerless. And you know, I don't think that you'll be able to fix that feeling in a conversation about voting with a client necessarily. But I think what you can do is validate that and say like, yeah, it feels really crappy how sometimes even when we are doing everything that we're doing, it feels like the people in positions of power just still aren't following through or living up to their values or that kind of thing. And that's why it's so important that we pay attention to local elections where decisions are being made right here in our backyard, and we can show up to town hall and give them what for if they don't make the decision we want. But then also, and are there people in your community that aren't voting who you could talk to about this so that you have more power collectively, or feel more power collectively rather than feeling like a lone wolf just casting your vote out into the void. So I think those are the two, like affirming and then saying, and local elections and collective power, who in your community can you talk to that might not be involved right now? That elected officials might not care about what our community thinks because maybe you're voting, but 75% of our community isn't voting or something like that.
Thank you.
Thanks for your question, Audra. Other questions for Chelsea or Madison? Also, while we're waiting, I do just want to again underscore, as they mentioned in their presentation, that this is a nonpartisan voter registration effort. You are not telling clients who to vote for. We all may have our preferences and we all may have, you know, our opinions on what's best for the country, but we're just trying to make sure that people have the opportunity to use their voices and participate in civic discussion. So you're not telling people to go out and vote for so-and-so or not to vote for so-and-so. You are making sure that they have the opportunity and know how to use their voice. Luann has a question: how do people change their party affiliation? Is that something you're able to address, Chelsea or Madison? I know it may be specific to different states.
It is specific to different states, and that's where the vote writers text line would come in handy. So if one of your clients had that question for themselves, or even if you wanted to scan the badge on the website right now and go talk to someone from vote writers about that, that's specifically like what their mission is to be able to answer specific questions like that. So do I need a voter ID? I move around a lot. Which address should I use? How do I change my party affiliation? Can I vote in a Democratic Party if I'm registered as an independent? Because that also is different from state to state. So all of those types of questions would be great questions for vote writers. And then also what I'll do, Jeff, is I'll see if I can find a civic engagement partner in New Jersey that kind of covers the like 101 voter guide stuff and send that to you so that maybe you can add that to your Civic Health Month landing page too.
That would be great. And I think this information is on our landing page already, but I just in the chat put a link to the Division of Elections of New Jersey, where they have all kinds of information about registering online, how you can update your address. And I would bet that there's information about changing party affiliation there as well. I'm also putting in the chat the link to the New Jersey League of Women Voters, who's one of our partners in these efforts. And they also are an excellent resource for voting registration information and voter rights information. And in fact, we will be doing a webinar in 2 weeks. I believe it's August 17th with the New Jersey League of Women Voters. That's going to be reviewing changes that have been made to New Jersey's voter registration and voting processes since the last election, and talk a little bit more about some pending legislation that is in New Jersey. In particular, there's efforts ongoing. If you probably can't see my t-shirt with the Zoom, but my t-shirt, which is same-day voter registration from the rally we went to a couple of months ago, but New Jersey is in the middle of trying to get same-day voter registration approved so that people who are eligible to vote can actually go in and register on the day of the election and still have a provisional ballot counted once their ability to vote is confirmed. So that information and more is all going to be up for discussion later this month. On the NASW New Jersey Civic Health Month webpage, there's a link to register for that webinar and a link to watch this video recording on YouTube will be embedded on that page again. So you'll be able to easily find this webinar so you can rewatch it, so you can share it with friends. And really, we encourage you to do that. Let your colleagues know about this effort. Let them know how important this is, and feel free to share this webinar widely, to share links to our webpage so people can find this information, and we can really mobilize in New Jersey to get people out to the polls and get them registered to vote. We've got a few minutes left if there are any other questions. I don't see any other hands raised. Chelsea put some more links in the chat again for Civic Health Month. Some comments. This was great. Thank you all so much for participating. While we're waiting, if there are no other questions, why don't I share my screen and I'll show you the New Jersey landing page really quick while we're here so you can see how that's set up. All right, so you see my messy screen with all kinds of things on it probably. But hopefully now you can see the NASW New Jersey webpage. And as you see this webpage, Chelsea, can you see that?
Yes.
So right on our homepage, you'll see the big announcement. It's Civic Health Month. And if you scroll down and just click Learn More, it'll take you right to our Civic Health Month landing page where you learn a little bit about Civic Health Month. And then you can watch the video. I believe this is the same. Actually, this is a different video than the one that Chelsea showed. This is a video, I believe, that just kind of walks through how the digital kits work. And then if you scroll down further, you can download the badge front and back. And you can also download a phone background that you can use on your screen. So you could just make this your background on your screen and have people scan with their cameras directly from your phone. And then there's a link to the Vot-ER website. And again, on the right-hand side of the screen, you'll see some related resources, increasing voter participation, New Jersey State Legislature, New Jersey Division of Elections. Training in political social work is a link to the Nancy Humphreys Institute for Political Social Work, who offers trainings throughout the year, I believe, for social workers who are interested in getting more politically involved or running in office. And then we've got links again to Vot-ER, Voting in Social Work, League of Women Voters of New Jersey. And then the recording from this video will be right here on the right-hand side. And your registration link for the August 17th program is there as well. So really easy to use, really easy to access. And thank you all so much for joining us today. It looks like there are no more questions. I see just some more thank yous. Chelsea's thanking everybody again. And we really appreciate you all for coming out today. We'll follow up with an email as well later today with a link directly to the YouTube page. So you have that, as well as resources. And Chelsea and Madison, are you able to share your slides as well?
Yes, definitely we'll be sharing the slides with you.
Okay, great. So stay on the lookout for a follow-up email. And thank you so much for joining. Get out there, talk to your clients, make sure they're registered, and hopefully we'll see many of you on the August 17th webinar as well. Thanks, everyone.
Happy
Thank you.
Civic Health Month.